Well, the Patient Safety First initiative is at the heart of what the Health Information and Quality Authority is about. One main objective is promoting the safety and quality of services for people accessing healthcare or social care in Ireland. And at the centre of all of the activities around the Patient Safety Initiative are a number of activities that the authority is undertaking, from setting standards for health and social care to monitoring that those standards are being met, ensuring that new technologies are used to promote safety and quality for patients. And what we're developing at the moment is a set of standards that we'll be using for licensing healthcare providers to make sure that services that are provided for people have to meet a certain standard of safety and quality in order to operate. Well, the authority has a number of standards that we have developed and adopted over the last couple of years, and these standards are quite specific around certain services like hygiene services, like symptomatic breast disease services. But we're about to launch a public consultation on a new set of standards that are standards that drive quality and safety across the health system. And this will be the first time that standards traverse primary care, acute services, public and private, across healthcare in Ireland. At the heart of these standards, it's about how patients are at the centre of their care, how risk is managed, how the services are led, governed and managed, how information is used to ensure learning takes place and that adverse events are prevented, all of which is around patient safety and quality. These standards will be monitored next year, and it's envisaged that these standards will be used for licensing healthcare providers, which will ensure that providers can't deliver a service, can't operate unless they're meeting the key standards for quality and safety. We found it very useful working in the Patient Safety Initiative, and the authority at the moment is developing a set of standards that are hugely important standards for driving quality and safety across all healthcare providers in Ireland, from primary care, ambulance services, hospital services. And the discussions and the elements of patient safety as part of the initiative are elements that have helped inform the development of standards, from ensuring that practitioners and people working in services are appropriately qualified and trained to provide services for patients, ensuring that patients have access to information about their care and control over their own care, ensuring that adverse events are addressed appropriately and patients are communicated in an open way when something goes wrong, to ensuring that services are as effective and efficient as they can be. So at a time of development that the authority is at, the discussions and the elements of the Patient Safety Initiative have been very useful.